public health authorities have increased preparedness measures as the Department of Medical Services directed hospitals under its supervision to prepare for potential Nipah virus patients. The Department of Medical Sciences says it is fully prepared to detect and monitor the Nipah virus after reports of a new outbreak in India, while health authorities are stepping up screening measures at airports.
Could the next pandemic make the height of the COVID-19 outbreak look mild? That's what some experts are predicting for what's being called Disease X.
So I am very worried that we just don't, we as a nation, we haven't made that commitment to really fully protect the American people.
We caught up with internationally recognized Dean of the National School of Tropical Medicine at Baylor and co-director of the Texas Children's Hospital Center for Vaccine Development, Dr. Peter Hotez, who's traveling to get his take on the topic.
We have a likelihood that new pandemic threats, people call them Disease X, are going to be rising on a regular basis.
And Dr. Hotez says Disease X, the next pandemic, could hit hard whenever it arrives. Why do you think some experts are predicting the next pandemic will make COVID-19 look like a walk in the park?
I've written about this as well. I wrote for the Houston Chronicle a couple of months back that COVID-19 is just the warm-up act. The next pandemic may not be as severe, but it could be much worse.
Didn't click on this deal for 9 tablets of 100 milligram generic Viagra for $7, thinking no way that...
The Department of Medical Sciences said the National Institute of Health is ready to detect Nipah virus in suspected patients using real-time RT-PCR tests, which offers high sensitivity and accuracy. The test can be performed on multiple sample types, including blood, respiratory secretions, spinal fluid, and urine, with results available within 8 hours. No case Nipah virus has been reported in Thailand so far. However, health officials are encouraging the public to take basic precautions, including avoid contact with animals that carry the virus, washing fruit thoroughly before eating, and washing hands after handling animals, raw meat, or animal carcasses, especially bats, pigs, horses, cats, goats, and sheep. Meanwhile, Chiang Mai International Airport has coordinated with international disease control officers to introduce proactive screening measures similar to those used during the outbreaks of COVID-19 and MERS. These include temperature screening for all incoming international passengers, distribution of health advisory cards, and stricter checks on travel history for passengers arriving from or transiting through outbreak areas within the past 14 to 21 days. Although there are currently no direct flights from India to Chiang Mai, authorities say they remain alert for transit passengers. Anyone showing symptoms such as high fever, headache, or respiratory problems will be transferred immediately to a designated hospital under public health response plans.
After years of pandemics popping up, including SARS and H1N1 early in the 2000s,
Ebola in 2014, and Zika in 2016, and now we've got COVID-19.
Dr. Hotez says that's why the U.S. Office of Pandemic Preparedness was created, but he believes more should be done.
Having the funds available to make countermeasures change, which is altering the migration of animals that can transmit these viral pathogens.
Now, no one knows when Disease X, the next pandemic, will hit, but scientists say it is coming.
Especially the Disease X, the first time we used the terminology was in 2018. The discussions were in 2017. I was just new Director General. As you know, we annually list the emerging diseases, and MERS could be one, Zika, Ebola, those we know. But then we said there are things that are unknown that may happen, and anything happening is a matter of when, not if. So we need to have a placeholder for that, for the disease we don't know that may come. And that was when we gave the name Disease X. So Disease X is a placeholder for unknown disease. I just wanted to start by clarifying that because there is already a lot of attention. If I may, although COVID came immediately, we were preparing for COVID-like disease. You may even call COVID as the first disease X. So whether it's in health systems or even the private sector, by the way, in research and development, for instance, you can prepare for it. Actually, it started with this disease X issue with a research and development blueprint. It's a blueprint. And research and development should be at the center also to test drugs, to test other tools.
The move involves close coordination between multiple health agencies to ensure rapid diagnosis and effective clinical care. Officials stated that while no cases have been detected in Thailand, the proactive stance is necessary to safeguard the public and maintain national health security. The Department of Medical Services has designated Rajwithi Hospital, Lertsin Hospital, and Noparat Rajthani Hospital as the primary facilities to receive suspected and confirmed cases. These institutions have been instructed to mobilize specialist teams, prepare isolation wards, and ensure an adequate supply of essential medicines and medical equipment. Furthermore, medical experts are collaborating to develop standardized treatment guidelines that will be distributed to healthcare providers nationwide to ensure a unified and effective response. Laboratory readiness has also been confirmed by the Department of Medical Sciences. Through the National Institute of Health, authorities are prepared to perform diagnostic testing using the RT-PCR method, which can detect viral genetic material from blood, throat, and nasal secretions, cerebrospinal fluid, and urine. To ensure accuracy, at least 2 types of specimens will be collected per patient. Testing results are expected to be delivered within 8 hours of sample receipt, enabling health officials to initiate swift containment and treatment strategies if needed.